Hello everybody, recording live from somewhere. This is Zach Couples with episode number 58 of the Movement Debrief. And tonight, folks, the debrief is going to be like, whoa. We're going to talk about hunching. What do you do with people who hunch, especially if their infrasternal angle is narrow? How do you deal with that? We're going to talk about hip extension. How do you restore hip extension in a reasonable amount of time? Stay tuned because I'll give you the answer to that. And last but not least, we're going to talk about stretching. Is that a worthwhile thing to pursue? I will give you the answer because these are questions asked from the people, answered for the people, by this people, fam recognize fam. Before I get into the questions, I have a question for you. Where do you guys fall short when you're working with your clients? I've found that really there's two places that people err, myself included, when we're trying to get a particular outcome: intent and execution. With intent, are you making decisions based on sound rationalization, integrating the evidence, and what we know about anatomy, biomechanics, yada, yada, yada? And then execution would simply be coaching. Are you coaching your clients effectively? A lot of people will either be really good at one, not so good at the other, or vice versa. Maybe you are a good coach, but maybe you don't have good rationales and you're kind of shooting in the dark trying to find the right moves. Guess what, folks? If you are struggling in either of those areas, there's a seminar for you, and it's called the Human Matrix, because that's exactly what we're going to go over. We're going to talk about how to rationalize and make laser-like decisions, laser focus, surgical, if you will, with your exercise selection. And after we've done that, we're going to teach you how to exercise effectively, program things effectively, do the moves well so you can get the outcome, which is most important to your clients. There's 3 of them, folks, September 15th and 16th in Seattle, Washington. The sign-up is still available. You guys should go. Then we're in October 27th and 28th in Kansas City, Missouri. I've been corrected. Thank you, Tim. And the last place, as of right now, will be November 10th and 11th in Portland, Oregon. I hope to see you guys there. Without further ado, let's debrief, shall we? The first question comes from a name I cannot pronounce simply because it is in characters of some Asian language that I don't know. Although I do know how to tell a girl she's pretty in Chinese. But that's neither here nor there. Hey Zach, I have a question. Should narrow infrasternal angle people who are hunched over also be reaching? Because they are already good at getting air posteriorly? If so, what are we looking for to change? Thank you. No guy who I can't even pronounce his name, thank you. It's a great question. Big thing with reaching forward. First priority with that is to normalize the infrasternal angle mechanics, which is why we emphasize the forward reaching. What that does is when I reach forward and I push the rib cage back and the thorax back via the pecs pulling this back, internal obliques, transversus abdominis, what that does is that takes a long anterior to posterior thorax and it compresses it and allows for lateral expansion. You need a reach in order to do that effectively. Just as if I go this way and I breathe in, even though yes, I am getting posterior expansion, I'm creating a relative bend in the ribs, which narrow infrasternal angle people have a hard time doing. So because of that, doing a forward reach to start is important. Once you've done that, in theory, if there was an external rotation limitation as well, because you are getting some posterior thorax expansion, that ought to improve. But a lot of individuals who have the hunchy position might be limited in being able to get the pump handle up. One, they might also be limited at the pump handle 2, or not the pump handle, but the scapular upward rotation, i.e. limitations in shoulder flexion. These would be things where after you've done the forward reach, might be targets that you may go after when you're designing some type of exercise program. So if I can't get someone who is pump handling up, what I'm going to do is maybe I'm going to work towards more overhead-based activities and reaching that way, doing things with arms behind the shoulders, making sure that the rib cage stays dropped on that inhale. And as you can see, I almost suffocated from that because that's what I need, because I stink at it, even though I am a narrow infrasternal angle and I hold that near and dear to my heart. So for those people, something with an overhead position, once you've gotten the lower rib cage to be a bit more dynamic, is pretty money. So please do that. Once that's cleared up, maybe they still have a limitation in shoulder flexion. What that can signify is a potential limitation in upward rotation of the scapula. So what would you do? Well, I'm glad you asked. I would do things that emphasize scapular upward rotation. If you're a coach and you don't got hands-on techniques, try some landmine presses, try some overhead pressing, anything that can get someone to do that. I stink at upward rotation because I don't have full flexion. Look at this, that's embarrassing. I can't believe I'm showing the internet this. So what I utilize, and this kind of kills two birds with one stone, is I utilize the downward dog position a lot personally, because when I hold my arms overhead, I clamp down and I try to breathe, I'm going to get the pump handle to come up, which I suck at. I will hyperventilate, that's crazy. And then because I'm getting that reach, I'm driving scapular upward rotation. Those would be things I would consider with someone who's hunching. So the long and the short of it is to use your testing to make sound decisions. If there's anything else left after that, which typically there isn't, but one spot that might be limited would be horizontal abduction. For those types of people, then maybe you're doing more rotational based things to try and restore that. If you do those things, a lot of times these people who got the hunchy kind of thing going, even though they're a narrow infrasternal angle, will have to clear up. You might not change this because there could be other factors as to why that is. Maybe there's something upstairs that's impacting that. But you will at least restore variability in these people by working in that fashion. So to summarize, if they're hunchy and they're narrow, still do things to restore the bucket handle activity of the rib cage. That oftentimes starts with a forward reach. Once you've done that, then what I would consider doing is, if they have an IR limitation, moving the arms up a little bit higher to allow the pump handle to come up. I would emphasize scapular upward rotation based activities to restore shoulder flexion. And then if there's any type of horizontal abduction limitation, try some type of rotational reach. If you do those things, you ought to be in business. Thank you for an amazing question, the unnamed warrior. Next question comes from Joseph from the UK. He's a classic. Yo, Big Z. Possible debrief question. Actual debrief question. It may be a dumb question, not true, but here it goes. If I'm lacking hip extension and I'm trying to choose activities that address this, how would I know when to choose an activity where the hips are flexed versus extended? Debriefs are Z-licious as usual. Appreciate you, big dog. So, good question. Hip extension. This is something that I was playing with a lot before, because I was having the same problem that Joseph from the UK was having, and that was restoring people's hip extension. And one of my thought processes as I'm working with people is, if I can't get them to do a particular activity, I'm going to try to drive them further and further into that range that maybe they cannot achieve, and a lot of times you'll see some changes. So for example, if I can't get someone to extend the hip passively with the hips flexed, I'm going to work them to more and more progressive extension. That was my line of thought, and a lot of times it worked, but it wasn't consistent, especially with that move. It wasn't until I went to the intensive with Daddy O Pops, he might be tuning in on Facebook, Bill Hartman, which, by the way, folks, I'm going to put in the show notes. You guys should try to apply and see if you can get into that, because it's a life changer. But it wasn't until I went to that I got a better understanding and appreciation as to why that thought process worked, as well as how to coach someone into that thought process. The key has to deal with what drives hip extension with people, and what can we utilize to restore hip extension. Now, if only I had a pelvis model with femurs. Oh wait, here's one. Cool. Hip extension. So, I have hamstrings which attach at the ischial tuberosity, and they go past the tibia, or past the femur all the way down to the tibia. They are best at extending the hip from a flexed position because they have a better leverage pull. What happens though is if these guys try to extend the hip past neutral or from neutral to zero, because they don't have a direct attachment on the femur up proximally, you potentially run into problems. And so what can happen is you get like a levering effect because of the poor line of pull. So instead of this pure hip extension happening, you get that. Now you're probably thinking, Zach, you're full of it. That doesn't happen. Well, actually it does. If you look up gluteus maximus gait, and I'll link it in the show notes. This is where an individual maybe has some type of neural condition that has negatively impacted innervation to the glutes, and so they don't have access to glutes. But if you watch these individuals walk, you see exactly that. I'll show you. But basically, you take a step, and because they can't use the glutes to get terminal hip extension, they'll lever forward like this. Looks really funky. But the reason why that occurs is because the hamstrings are the primary hip extenders beyond that end range for that person. Now, the glute max attaches, maybe, let's use this one. The glute max has a distal attachment right at the gluteal tuberosity, which is on this portion right here of the linea aspera. So it kind of runs like this over the femur. So it has a much closer contact point to the joint surface to allow for a pure hip extension to happen. So if you want to clean up someone's hip extension, once you've used hamstrings and you've milked them for all they're worth, you probably want to emphasize glutes. The cue of the century, which I got from Daddy O Pops Bill Hartman, and I'll link a couple activities that I've been using, is the back pocket tuck. If you can get someone to do that, a lot of times they'll feel that inferior portion of the glute max, and if you can get them to hold a good position, breathe in that position, you will oftentimes restore hip extension fairly quickly. It's been pretty remarkable by doing that. What I mean by the back pocket cue is imagine that someone grabbed you by your back pockets. If you're lucky, you can grab mine. And they pull the back pockets down towards the heels, as an example. Or if I'm hook lying, it's up towards the knees. Being able to cue that, and if you do some good things with either hip AB or adduction, you can see some appreciable changes in hip extension. Once you use that cue, the simple way to drive further hip extension is to get them to end range. So you might start someone with maybe a 90-90 position, then you're going to hook lying position. Once you've done that, then maybe you're going to closer to end range extension. What I typically will do for people is start them hook lying or in the 90-90, and then I'll go to like a squat position, then I go to a sideline position where the hip's extended, and then I'll go with like a quadruped on elbows hip extension. And I'll link those drills in the show notes. But if you do those things, then you can maintain that positioning and make sure that the people are feeling the inferior glute max when they're doing that. And if they're not feeling it because it's a foreign movement, if you have a good rapport with your people, just give them a palpation there. And like, you don't have to go right on the tush. Just go inferior to that, maybe where proximal hamstring is, because it's a little bit less offensive. And be firm with your contact. Don't cup. That's no bueno. But put that there, see if that's getting the contraction, and then you know you're on the right track. So to summarize that point, just from the UK, hip extension, your big guys are hamstrings and glute max. Hamstrings do not have a direct attachment proximally to the femur, so they're good from flexion to zero, but past that, that's a problem. You get some levering. Look up glute max gait. What is the money muscle is your gluteus maximus, which has an attachment that is much closer to the joint surface, or the joint surface of the hip, because it attaches at the gluteal tuberosity, allows for greater pure hip extension to occur. The big cue, the back pocket tuck. Start them flexed because it's easier. Once they've got that down pat, then you progress them to hip extension closer to end range, because what we're trying to do is drive people into these particular ranges. So the closer you get them to the end range, the more challenging it's going to be, but the greater reward. Joseph from the UK, unbelievable question. Last question comes from my boy, Tyler Wall. It's like question asker of the year. I love it. The question is, well, it's kind of a statement. Why stretching may not be good for you. Side note, So many patients have this preconceived notion that there are stretches to fix their injuries or limitations. Even after a few weeks of working with them, they often refer to doing their stretches, which may just develop into a catch-all statement. Do you have this experience? Well, last point, I certainly do. I will give anyone anything, and it's always a stretch. 1 RM back squat, it's a stretch. Yeah, so I agree with that, Tyler. But let's talk about stretching. Maybe this is, I've been thinking a lot about questions like this in terms of if something is good or if something is bad. And I actually had a patient today who I've been having a hard time with. He's actually the hip extension guy. It's just been like, he's a guy who levers when he gets to that terminal extension point in testing. And I've been having a really challenging time trying to find the right move for him to get it, because it's like I get him to end range extension and there's pain. So I was gone for a couple weeks. And when my colleague saw him and gave him a bunch of stretches, guess what? He's actually doing a little bit better. So I think where some fear comes into people stretching is because there's some sort of preconceived notions that we have power to develop laxity in people. And unless they're a young gymnast or something, or an individual who's more predisposed to being floppy, chances are we're probably not going to be doing that, people. And you can hurt people, obviously, if you stretch incorrectly. But it's probably not as offensive as one I would think. And I remember way back, I couldn't tell you what debrief this was, but someone kind of stirred something into my brain in regards to stretching. And I'm sorry if I can't remember who you were, but you're near and dear to me. If you think about it though, with every movement that we do, there has to be a stretch somewhere. For example, if I'm gonna flex the biceps, instant replay, if I'm gonna flex the biceps, in order for me to do that, my triceps have to stretch or eccentrically orient. Is this not a tricep stretch when I'm getting my gains? Well, I think so. You mad? You mad that I'm stretching? I'm gonna stretch right in front of you. No, that's okay. Like, this is stretching, eccentric orientation of muscles is a normal phenomenon that should occur. Now, is it a useful phenomenon? I don't know. It depends on the points that I made very, very beginning, intent and execution. Where I think people run into trouble is they will program stretching without having a good rational reason to do so. Oh, my hamstrings feel tight, so I should stretch. What if you have a 125-degree straight leg raise and your hamstrings feel tight? Is that the right fix for you? Probably not. What if I do this to my arm, I can feel a big stretch on my bicep and it feels tight. Should I stretch it? I hope you guys are saying no. Because when I do that, this is at end range. Why should I stretch it even further? It has to do with being precise with your decision making when you select an activity. You should have some type of objective measure, whether it's a table test or whether it's some test you're doing on the training floor. I don't care. But you should always have a reason why you're doing something. And if you're trying to stretch or target a specific movement or a tissue, you probably need something to support making that decision. And I think that's really where stretching goes wrong, is you just have people stretching everything, and that might not be the solution that they need. If I have someone in my case before where they can't get full hip extension, well, if I get them here and I'm doing the hip flexor stretch, that might not necessarily be a good thing if they don't have glutes, because then they get that levering phenomenon. And they get pain in the front of the hip and they hate you. And I hate you for doing the wrong move. I don't really hate you. I don't really hate anyone. Stay tuned. Maybe I do. I don't think so. But point being is, for that person, even though they have a limitation, that wasn't the right fix, unless it gets you the outcome you want. And that's what it comes down to, folks, is getting outcomes. And if you have good rationalization, good intent with your exercise selection, and it's executed properly, and that can include stretching, guess what? I'm not offended by it. Use it. I don't care what you do. I've told people, countless people this, where they ask me, is this exercise okay? I simply reply to them, did you get the outcome you wanted? And if they say yes, then I say, guess what, so-and-so? I don't give a shit what you choose as long as you get the outcome that you want and your clients want. That is the most important thing. And if stretching is your way of doing that, I got zero beef with it. We're always stretching every time we move. That's eccentric orientation of muscles. It's cool. So to summarize, I don't think stretching is bad. I think the problem is that people just don't have good reasons why they incorporate stretching. But if you can utilize some type of objective testing, some type of reason, execute it effectively, and get the outcome that you and your clients want, stretch away, folks. And I think that's a good stopping point for us tonight. I want to thank all of you beautiful, sexy, outstanding people for tuning in. If you want to learn more about me, here's where you can find me. Well, you can find me in Susanville, California if you want, but don't come here. There's not really much here except for a lot of smoke. But if you want to find me on the interwebs, go to zachcouples.com. While you're there, subscribe to my newsletter. Here's what you're going to get. You're going to get about 4.5 hours of me blabbing about something like breathing, rib mechanics, pain, all of that stuff. You're going to also get about 50 pages of notes. You're going to get a free, yes free, acute to chronic workload calculator. You'll also get weekend goodies every Friday. Those would be the big reasons to be a newsletter subscriber. And guess what, folks? I'm going to be putting out some products in the future. The Human Matrix is likely going to come straight to home, not DVD. People don't use that anymore, but I'm probably going to be recording that at some point. If you want to be like part of the fam discount, you'll want to subscribe to the newsletter. So please subscribe. Also, while you're there, click on the services section. I can help you with lots of things. Maybe you can't get hip extension and it's bothering you. Well, guess what? I happen to be a certified hip extension getter. You can check my CV to prove it. I can help with things like that. I can help with the hunchy kind of thing and you want to get your arms to go overhead because maybe you want to overhead press. A movement consultation can help get you there. What we'll do is it'll be you and me just like this. And I am going to take you through an evaluation. We're going to do some activities. I'm only going to give you things that work because I'm anal retentive, and if something doesn't work, we're going to go on to the next thing. That's a movement consultation with me. Please sign up. Once you've done that, then what you're going to want to do is do mentoring with me. Maybe you want to understand the hip extension piece better. I just got this. I'm a little juiced up about it. Maybe you want to understand that better. Maybe you want to learn how to apply some of the stuff that I've talked about with your clientele. I can be your guy. Hit me up for mentoring. Or maybe you're post-rehab and now you want to get strong since you got hip extension and all these other wild and crazy things that we worked on. Hit me up for online training. What we'll do is I'll write you a program monthly. You will get a movement consultation within that. We'll talk back and forth throughout the week to make sure things are going in the direction you want them to go, and we'll get you to where you need to be. Definitely hit me up for online training. Other places you can find me: Facebook/ZCouples. Twitter, the handle is @ZCouples. That Instagram, baby! Zach, Z-A-C, Couples, C-U-P-P-L-E-S, and YouTube. Just search Zach Couples, you'll find me. If you don't like looking at me, which I don't blame you, you can listen to me on either iTunes or Stitcher by searching the Zach Couples Show. Because guess what, folks? There's 57 other debriefs you probably want to listen to. Take me on a nice car ride. I like long car rides along the beach. Maybe the US 1 in California. I don't care. Take me there. Last thing. Well, those are all the places you can find me. But if you guys want to attend the Human Matrix and you want a snippet of the manual, if you go to the website, click seminars or do zachcouples.com/seminars. I have about 10 pages of the manual talking about normal respiratory mechanics. Hopefully it'll blow your mind. I hope you guys like it. Thank you guys so much for tuning in today. I hope you have an amazing rest of your week. Keep it real, but not to the extent where things go wrong. Stay hungry, stay learning, stay moving, and I'll see you next time. Deuces.